Thank you all for attending the webinar tonight. We're very excited to bring you this webinar, which is a series in the group by MyCareConnect Blueloop, transitioning from high school to college. And this is a topic that we've heard from many parents about as far as what they would like to hear in a webinar series. And at the end of the webinar today, you'll receive a survey. And please feel free to give us more webinar ideas, since we are here to help in any way we can. And we'd love to provide information that you'd like to hear. We're happy to bring you a group of expert panelists who will give peace of mind information to parents to keep you confident that your child has resources and is safe when they go away from home. We also want to make students who are gearing up to go off to college, give them the same confidence as well as a feeling of independence as they journey away from home and on to college. I'm Pam Henry, the founder and CEO of MyCareConnect Blueloop, and my daughter Sarah has type 1 diabetes. She's 16 years old, so she's not yet going off to college, but she is starting to drive, and I am starting to have those concerns with her gaining independence. So as we go through this, I'd first like to tell you a little bit about Blueloop, which is MyCareConnect's program, and then Christina Roth and Joe Treitman are both with the College Diabetes Network, and their organization mission is to empower and improve the lives of students living with type 1 diabetes through peer support and access to information and resources. Christina is the CEO and founder, and Joe is the program director, and both attended college with type 1 diabetes. So first of all, I'd like to lay some ground rules on how the webinar will work and how you can respond as you have questions. We do have 1 hour for the webinar, and in order to stay on schedule, we'll start with Blueloop, and then you'll be able to ask or submit any questions that you have about Blueloop. And if you would like to receive a one-on-one phone call later about Blueloop, we'll give you more information about how to do that at the very end of the webinar. And then once I am done talking about Blueloop, we will give the stage to Christina and Joe with the CDN. And you'll notice that on the left side of the screen in blue will be a list of topics. And after each topic, we'll give you a chance to submit questions. And once again, these questions will be compiled, and either Christina or Joe will be able to answer those questions for you as we go through the webinar. Now, if we do run out of time, you have two choices. One is we're happy to go a little bit longer on this webinar in order to make sure people's questions are answered. Also, you can feel free to contact us after the webinar. Okay, let me start by telling all of you about Blueloop. I've already told you all, first of all, that who the presenters are. So I'm the person at the top. I'm Pam Henry. And then, as I said, later we'll hear from Christina and Joe with the CDN. And unfortunately, Kelly Crumpler was not able to attend tonight, but at the very end we will give you her contact information as well. So Blueloop is a company that was created by MyCareConnect. I created it back in 2008 after my daughter was diagnosed with type 1 diabetes. And basically, it's a communication tool. We are HIPAA compliant, and you can access Blueloop either online or with our iPhone app or with our Android app. The features and benefits of it are that you're able to share information with your physician or CDE. They're able to communicate to you through Blueloop. And also it provides parents peace of mind so that they won't have to nag those of you out there who are about to head off to college. As I said, we do have the various apps as well as this being an online tool. And it's a lot like Facebook, where anywhere you can access the internet, you can access Blueloop. And the way it works is that you give access to various caregivers, you being the student with diabetes, gives access to various caregivers, and you're able to control how much access each of those caregivers has. And you can set up alerts or notifications to those caregivers as you see fit, or those other caregivers can simply log into your account and see how things are going. This is just a quick picture of our mobile apps to show you how easy it is to enter information. You would simply set up your same login and password that you have with your online account. Then you're able to enter blood glucose, carbs, insulin. You can write a note if you need to, select an event, and you simply then hit save, and all that information goes into your account. It builds blood glucose logs as that information is being put in, and it also captures dosage information, a history of all your dosages and medications. So this becomes a permanent record that belongs to you, that you have, that you can take on with you as you make that adjustment from a pediatric endocrinologist to an adult endocrinologist, and even beyond that. So I'm now going to turn over the stage to Christina and Joe to talk about the College Diabetes Network.
Great. Thank you so much, Pam. So this is Christina. As Pam mentioned, I'm the founder and CEO of the College Diabetes Network, and with me is Joe Treitman, who's our program director. And CDN, as Pam mentioned again, is a 501c3 nonprofit, and we work with students throughout the country and in Canada, not only just around their life with diabetes on campus, but also to create these networks on their campus that they have in-person support from friends and people going through the same thing. And we do that through a few different ways. We have our website, which provides online resources for students and their parents on all aspects of life in college with diabetes. And then these chapters, so our campus-based peer networks, which create this larger community that spans the whole country. And we have other projects that support specific areas of the experience as well. So we have a Diabetes iPhone application, which allows you to stay in touch with your friends, and many other ways to support you. So we're looking forward to telling you a bit more, and we are always available for questions if you have them. You'll see Joe's information at the end of the presentation, and we'd love to hear from you. So I guess really quickly, just why do we exist? We had gotten started back in 2009. I was a student at UMass Amherst, and was probably like many of you or your children, just getting there, loving the experience, and then really feeling that diabetes either needed more support from me to really get going, or just in general, I needed to connect with other people, and there wasn't a way to do that. So that's what CDN came out of. And yeah, no, we're excited to talk to you about the rest of it today. So I guess I'll move. So to get started with the first section, which is independence. So I'll start off at the beginning, and then I'll let Joe continue on with the rest of it. So the big thing that comes to mind kicking off responsibilities is just getting on the same page with one another. So coming to some agreement, or we can say contract, but more of an agreement between the child and the student, the child and the parent, to really find ways that you both feel comfortable with all of the different aspects of diabetes and getting ready to leave. And the big example of this is, of course, those nighttime blood sugar checks. So at this point, your child might be doing them, or you still might be doing them, and we actually get a lot of emails from parents all the time asking, they're terrified of sending their child off when they're still doing these blood sugar checks, or afraid their child won't do them when they're off to school, and what will happen when that happens, and can they leave with their child? And we definitely don't recommend going off to school, but there's a few different ways that you can both feel comfortable around issues like this. So for this instance, I know at least with my family, we found that a CGM was really helpful, a continuous glucose monitor. It allowed my mother to sleep much better at night, and it allowed me to know what was actually going on and feel like I had the tools to take care of it, and then the support from her to deal with whatever came my way. So there are a few other responsibilities that Joe will go over as well. But the big take-home is to just talk about them together and find how you all feel comfortable, so that they don't have to be an issue when you're off at school and just wanting to enjoy life.
Awesome. Thanks, Christina. So this is Joe, and I just wanted to bring up a few other things to have the discussion around. So who has responsibility about daily management and packing the bag for the day? supplies when you're running low, and traveling, kind of if you're going away for the weekend, who's involved in preparing for that. As Pam mentioned, driving is definitely something that everyone's talking about right now. And you want to make sure that both parties feel comfortable and safe around that. So really creating a plan and sticking to it and reevaluating. And last on this topic is accommodations at school. So many of you students are probably taking SATs and ACTs, AP classes, and also they have to talk about diabetes to their friends sometimes. So it's really the beginning of being independent at a school. So the next thing to discuss is clinical care. So a lot goes into doctor's appointments. Who makes the appointment and who prepares questions, who has the logs, who remembers the prescription refills, and who goes. It might be that there comes a time when the parent and the child decide that it's just not time for the parent to be there anymore. And to really have a procedure where you know what's happening, so you students know where to go, what to have ready, to have your insurance cards, so to really be prepared. And one last thing about that is when you turn 18, you students need to sign a release form for your parents in order to access your information and saying that you feel comfortable with that, so be prepared for that. And so one last thing that we we're excited about is this partnering initiative of ours with drinkingwithdiabetes.com. They have some great information, and you can access it from our website. And it's resources for both parents and students, urging them to have that discussion and really get educated and be safe and realistic and really have the discussion to be open about alcohol. And so definitely check that out. And this is another instance where a CGM might be helpful. Wearing a medical ID and just making sure that you're being safe. So I think that's what we have here. Pam, are there questions for this? Hello?
Yeah, I'm sorry. I'm not seeing any as of yet.
Oh, okay.
But if you can hold on just a moment, we're having a little technical difficulty with receiving questions, so I apologize for that. If you guys don't mind, we'll go ahead and move to the next slide. And if you do have questions and they are not addressed through the remainder of the slide presentation, just hold on and hopefully we'll have the issue resolved by the time we do get to the end and we can answer those questions then.
Okay, great. So we'll make sure to do a call at the end, and for anybody listening, feel free to submit those questions as we're talking, and we can address them as we get towards the end as well. So now probably is the section that most of you are actually interested in hearing about, which is actually when you're starting to look at schools and getting ready to go off, and those exciting, scary times that come with that. So first and foremost is probably just bringing up scholarships, right? Mostly because for most of these scholarships, they're actually geared towards incoming freshmen, we found, for those with diabetes. So most of them have early deadlines. So to definitely get on the wagon with those early. One of the best places to start looking is the Diabetes Scholars Foundation. They're an amazing partner of ours, and they do wonderful, wonderful things and give a lot of money away to a lot of very deserving students. We also have the scholarship webpage on CDN's website, which of course has the Diabetes Scholars Foundation accessible through that, as well as many others that we've just found randomly kind of throughout other organizations and schools and across the country, just listed all right there. So you can check them out and see if you qualify for any of them. But we definitely suggest doing it because if you know about them, it's worth the time to go ahead and submit those. I think the second thing to bring up is that as you're starting to look at these schools and you know what schools you might be interested in, shoot us an email, give us a call. We're more than happy to reach out to our chapter leaders or students that we have on these campuses, and they're more than happy to talk to new students. So we'd love to connect you with them. You can ask them what it's like to live with diabetes on that campus or issues that they might know of that come up specific to that area. So when I created CDN and as we've gotten started, that's one of the things that's been in the back of our minds from the beginning is being able to provide that to you. So definitely get in contact with us. We love helping with that. The third is, I'll actually let Joe take it from here, but really in relation to just things to think about as you're going on these school visits and you're hearing what's available on campus.
Great, thanks, Christina. So I guess the first thing is access to supplies and care. So if you're going to a school kind of far away from a big city, then you want to find the closest pharmacy and the closest hospital, just in case of an emergency. But on campus, talk to the health center, find out if they have a diabetes specialist and what their hours and location are. And some students have even advocated to have a diabetes specialist, and that's happened, so that's very exciting. In terms of having your supplies shipped to you, talk to either your tour guide or whoever you're talking to at the school that you're visiting about mailroom shipping, and if the health center would be a possible place to ship those supplies. Some students get their 3-month supply, others will have the monthly supply, but it's definitely something to consider. And where to store your supplies, how to purchase your low supplies. Parents, you can really help out with care packages of juice and gushers and all that fun stuff. And I guess, so next up is the dining hall. So students, there are sometimes different types of meal plans that you can choose. And based on that, you might need to access supplemental food and really try to find out the hours of operation and location of those dining halls and advocate for yourself or be prepared to once you get to school and you can talk to them. So we'll discuss that in a bit. But if there is a dietitian available on campus, it might be a very helpful resource. And last but not least, the disability services is one thing that both Christina and I really wish that we knew was important to do. So if there is a disability services on campus, definitely register with them. And I know that some people with diabetes really don't think of themselves as having a disability, but this is a chance for you to have the school on your side if there's an issue academically, if you are too low to take a test, if you wake up with ketones before your final, and it's really difficult if the school just isn't on your side in a situation like that. But the other thing is that you can get access to a dorm room that is in a better location or near a dining hall. And so it's really just making your time on campus with diabetes easier. And we'll talk a bit more about that once on campus. So if there are any questions at the end of this section.
We're still waiting for those to come in at the end, Christina and Joe. So I do have a question about the disability services as,
sure.
Again, someone who's not experienced college yet, but I'm looking forward to it / not looking forward to it. On the disability services, is it up to the student to talk to each professor, or is that something you would recommend or have had experience with?
So this is Christina. So it depends on the school. Many schools, depending on how big or small they are or how familiar they are with diabetes, might have a little bit of a different procedure. But unlike what you might have experienced already in high school or middle school, where you have a 504 plan in place and it's the school's responsibility to make sure that you're covered, as soon as you're in that university setting, they don't have that responsibility. So if something goes wrong, by registering with disability services, it's really the way that you have that plan to fall back on. In terms of actually talking with each individual professor, that in most cases is specifically the student's responsibility. And usually there'll be a first day or week of classes, and they'll do a call for just any issue or any disability or things that might come up over the course of the year. And many professors will say, you know, let me know now or within this week, and then after that, you won't have an opportunity to bring it up again. So not only telling the disability services and registering and having that to fall back on, but in many cases, students, you will have to advocate with your professors, with each professor every year. But if anything comes up, it's being able to fall back on that plan that matters.
Okay, great.
So we're going to move on to preparing to leave. It's a very exciting time for everyone. And I just want to bring it back to what Christina brought up at the very beginning about having that discussion and finding out kind of what both parties are happy with and really discussing everything and reevaluating your relationship through this transition. So we actually have a mock contract that we will be posting on the CDN site. But now is the time that you want that to already have been in place so that you can enjoy your last days at home and your first days at school without constant arguments about who's checking their blood sugar and when, and instead of trying to reevaluate during all of the craziness of college, that you've already had that set up. And also who is responsible for what, because this is going to be a big change for everyone involved. So next, again, clinical care preparation. So not only do you want to be able to prepare with your current endo, but many of you might be transitioning into an adult endocrinology right now, and others get to stay around for a few years during college. But this might be a good time to look for an endocrinologist nearby and finding a team near your school, especially if you're going to be far away. And if you are going to move into adult care, to be prepared for that and to really have that discussion with your pediatric endocrinologist and with your parents about how to go from there. And one option that Christina and I think is a great remote option is Gary Shiner's, his clinical model. It's remote, and it's called Integrated Diabetes Services. So it's a way to talk to people. So next up, we have budget considerations. So co-pays, monthly orders, other prescriptions, if you're going to purchase a smartphone or even low supplies. Things to consider, so to be ready for those costs. If you have to travel to and from the doctor or the pharmacy, as well as emergency supplies and bags to carry those, all of your supplies in. And so next I'm going to turn it over to Tina to kind of go through a checklist to be ready.
Thanks, Joe. So I'm actually going to expand on a few things that Joe just mentioned, and again, we'll have a mock checklist up as well on our site. But the supplies plan, just making sure that's already set. Where will they be sent to? If you're with a mail order company, do they have that address? Because many people have had the supplies sent to the wrong address, so being ahead on that. Knowing who's going to order them and knowing if they will know that you're getting low, if you're not the one who's going to be ordering those supplies. The medical alert ID. Do you have one, and do you like it? You want to make sure that you like it because you're going to be much more likely to actually wear it if you do. Next is the sick day kit, and this is actually a way that I know my mom felt much more comfortable sending me off, as she got this great sick day kit together. And that had fluids and glucagon and my alternative basal rates and just things that I can just go to when I feel miserable when my mom's not there to take care of me. Then a plan that you've already created with your provider around any pump break or ketone situations, and making sure that that's also in the sick day kit is very key. And actually, I would insert here too, one of the ways that a lot of our students work with one another is if they are to have one of their pumps break or they have a ketone situation, even if they're not actively involved with the chapter on campus, to at least have somebody's cell phone number so that if you need backup insulin, if it's got frozen in the fridge or something happened, you can call them and they can help to make that situation much easier while you're figuring the rest of it out. Next in the sick day kit is, of course, the glucagon kit, and they can be a little annoying to get and make sure that they're everywhere, but making sure that it's in that kit. And then we've also had some great suggestions from people to even tape it beside your bed on the wall or tape it on your desk so that your roommate knows where it is. And of course, maybe even talking with some of your friends as to how you're going to talk to your roommate about that glucagon kit and how you're going to talk about it and bring it up and what sorts of things you're going to explain about having a low and what you feel comfortable with that conversation. Fridge access. This is one a lot of you might be thinking, of course, already to have your insulin, but to have it there ahead of time on move-in day so your insulin can go right in front of it. And then when you're there on move-in day, to check the temperature, because we've heard from a lot of people that it's up on high to make it nice and cold and their insulin freezes. So check that temperature just so that it's not too cold so that you avoid that, because it's definitely a small thing to think about on that day. Backup meters, batteries, chargers, they always are lost when you need them. So making sure that you have plenty of them and you know where they're going to be. And then we all know this, there's a lot of stuff with diabetes, so making sure that you have that big bag to carry around campus and keep all those low supplies in and that pump supply so you don't have to go back to your dorm when it pulls out, but also to have a small bag. This might be more accurate for the girls that are going off to college, but if they're going to go out with their friends at night, skinny jeans don't have much room. So you want to make sure that you have at least a cute little bag that they won't mind carrying that meter in. Guys might have a little bit more leeway with those bigger pockets, but finding something that they'll actually want to carry around. And there's many different diabetes-specific ones that you can Google, or you can, of course, just find something that you like. Another thing to keep in mind is if there will be a lofted bed where you are. Do you have bins to hold all your supplies? Will you be able to have them organized so you understand them? And this especially comes into play with if you have a low in the middle of the night. So whether you have stuff stashed in the corner of your bed all the way up there in the air, or if you have something that somehow attaches to the wall with some juice, to make sure that it's easily accessible so you're not climbing up and down when you're low. And then again, just the accommodations, have you talked to anybody? Have they sent home a health checklist already? I know many college health centers will send that ahead of time, but even though you might have indicated that you have type 1 diabetes on it, many of them do not have a system in place to then know what to do in that situation. And that's something that we're working to change, but many still don't have that. So you're still going to have to go in or make the necessary phone calls so that they know that you're either coming or so that they're aware of what they might have to do to accommodate you, because they might not know. So to just be patient with them.
And so we have a bunch of questions now, actually.
Oh, great. Okay, so we'll get started on some of these questions.
First of all, ladies, if you don't mind, this is Pam. I'm the person who gets these questions, and I have asked Joe and Christina to answer those that are relevant to the CDN and preparing for campus life and being on campus. But there is a question I can answer first, which is someone asked about getting a copy of these slides to review at a later date. I'm glad you asked that. We will have a copy of, provide a recording of this webinar. It should be available early next week, and it will be available both on the MyCareConnect Blueloop site as well as the CDN site. And we will send out emails to everyone who is participating in this webinar to let you know that those are available.
Great.
All right, so we'll get started with questions.
Okay, so I guess we'll start. So this question asks, does the local CDN chapter on campus advocate on behalf of all T1D students, and is it recognized by campus leadership? And so that's actually a really great question. A lot of our chapters are actually very different, and they're at different levels of development, but our ultimate goal with these chapters is to get them registered on campus as student groups so that they have that infrastructure and sustainability structure to keep them going for a long time. And we help to support them with that in many different ways. What most of Joe's job is, as she'll tell you, is just talking with students all the time. So she's always available to help with any issues that come up or troubleshoot issues, whether it's with administration or things, just other issues.
Yeah, and I do have to say that a lot of the students who do decide to create chapters care a lot about advocating for diabetes on their campus. So that's definitely something that they do, and just having the presence on campus makes it easier for other students to talk to their professor, to eat in the dining hall, stuff like that.
Okay, so the second question, and if we didn't answer that fully, please just send another one along. Should a student have any doctor's orders on file with the health clinic on campus like they have on file in high school? And I think that if you have that ability, it's a great idea. It's a great safety net. Again, it depends on the clinic whether or not they'll have the system in place to actually accommodate those or understand them. So maybe as you're talking with the health center and asking them if this is something they can do, to gauge their reaction to that and how familiar they are with it, to figure out what sort of backup systems you might need in place for that. And that might be something ongoing that your student can follow up with them on as well. Okay. So the next question is, did availability of services determine your choice of schools? And actually, I've actually been asked this question quite a bit, and they didn't. It just helps to better educate you as far as what you're getting involved with and what sorts of issues that you might have to troubleshoot as you're going through this, but it definitely shouldn't dictate where you're going to go or limit where you're going to go. And what we've actually, a great story that I've heard is we had one family on the West Coast, and they were very hesitant to send their child all the way over to the East Coast just because they were very concerned about their diabetes. And because there was a support system through a CDN chapter on the campus that he was interested in, they felt comfortable sending him. So figuring out what sorts of support systems that you would feel comfortable with sending them to some of these campuses that might not have the resources that you would like.
And I just have a quick note. This is Jo, and I actually, when I was looking at schools, we basically decided that if I stayed within kind of New England, I could stick with my endo team and stay with them through college, and if I decided to leave, then I would just try to find another team. And I really liked my nurse, so I just wanted to stick around, and I felt more comfortable being close to home. But that's not quite the services on campus, but it was definitely my support system in the area.
So the next question, could you expand on the information about Gary Shiner and integrated diabetes? So we are probably not the best people to do that. He's an awesome guy, and we love working with his organization. I believe that we actually had a recent blog post from one of our students talking about her experience working with him. So I'll make sure that we repost that on our social media for anybody who's interested. But he does have a website. It's just Integrated Diabetes Services, IDS, and he has a newsletter that comes out every month. Also, if I know there are some questions with insurance around the way that his program is set up. So if your insurance doesn't support his system, it's also something to talk about with your current provider in terms of if they can do email check-ins, phone check-ins, or even Skype. Some might have that capability as well.
And here's another one.
So the question is, I generally have to stay up past midnight to make sure my blood sugar will be okay overnight. Is there a way around this? That is a great question. If you have a provider that you're comfortable with talking about this issue, they might have better insight into your personal diabetes management. I would say that from my own personal experience, I mean, I mentioned this at the beginning, I found that my CGM was very, very helpful to me because it made me feel much more comfortable going to sleep with numbers I wouldn't necessarily go to sleep with otherwise, or knowing after a week of doing something specific how it actually worked and how to make adjustments based off of it. So you might find that that works for you. And I think Jo's had a different experience herself.
I actually didn't start using a continuous glucose monitor until after college, but I did. I would use alarms, especially if I had a lot of exercise later in the afternoon, just to double check at 3 a.m. if everything was okay. you got to make it loud, but sometimes you'll remember to wake up to it. And having a roommate there will probably help with that. So, all right, we still have a few more questions.
So next question. Additional transition tools for providers, pediatric and adult, and patients/families are available on the Endocrine Society and National Diabetes Education Program websites. Yes, thank you for bringing that up. They actually have wonderful transition resources. They are geared towards providers, at least the ones that I'm familiar with, but they are wonderful, and I believe they are either up on our site already or they are slotted this week anyway. So definitely check them out as well.
So this next question is, do you typically notify dorm staff about how to administer glucagon? So we could have brought this up in the next slide, but we might as well say it now. So we usually tell students and their families to make sure that someone knows how to use glucagon if they feel comfortable with that. So to tell your roommate if you feel comfortable with that, maybe if you have an RA or a resident director in the building. But it really depends on your situation and what you feel comfortable doing.
Yeah, and I would actually add to that. So we've actually found as we're starting to work with more campuses that different campuses have different levels of comfort with their RAs or their RDs actually administering glucagon. So some schools might have policies, and the RD or RA will be aware of these, that they might not be allowed to give glucagon. And of course, there are different ways to address that with each of those. And if you ever run into any legal issues, the ADA has wonderful legal help always available, and we work with them, and their advocacy guides is available on our website. But different schools will have different systems in place around glucagon. You know, shots are scary to everyone else besides us. So this is just another one where it looks a lot bigger and a lot scarier. So definitely let us know if you have any issues with that, and we're happy to help. To move on to the next question, how active is CDN in Canada? To be honest, this is the first time I've ever heard of CDN. I'm glad. This is probably for most people too. They're very familiar with children with diabetes, but never heard of CDN. Awesome. No, we're excited that this is your experience hearing about us. So Children with Diabetes is an awesome resource for those that don't already know about it, and they have a conference every year. They're a wonderful partner of ours, and we'll actually be there this year talking about the same things, leaving for college. So CDN is relatively new. We just got started a few years back, really became a full-time organization in the past year. We have much more of a presence here in the U.S., but we do have several chapters in Canada, and as students contact us, we can absolutely help them and make them part of our network. So we're expanding more and more every day, especially now that we can actually spend some more time on it. But if you have any more questions in addition to that, definitely let us know. I would be happy to help out. Do we have any more questions? Or?
That's all I see. Pam, do you see any more questions?
Yeah, that is it. We do have one more, but I'm thinking it might get answered on the next slide. So if it doesn't, then we'll certainly come back to it. And just to do a time check, we have a little over 10 minutes. So I think that we're doing well on time, but just to make everyone aware.
Yeah, and I think that a lot of the next slide we've covered a bit. So
great. Okay, well, so this is Christina. I'll get started with this slide. And so at this point in any presentation, when we're talking about, a student leaving for college and them being on campus and they're a full-fledged student, now is when we start to differentiate really between the things that the student will do on campus and the things that the parents are doing and where they can fit in with their student. Not to discriminate, but mostly because this is when that flip gets switched. And the student is starting to take responsibility for this, and more importantly, probably on the campus setting, is that they're going to be the ones that are held accountable for this. So to really just start off with a few of those things, then we'll talk about you parents and how we can help you out too. So with the students, we've already talked a little bit about telling roommates, professors, RAs, friends. But I think the biggest thing that we haven't talked about is just actually how to do that. And we don't have enough time on this webinar, unfortunately, but it's something to definitely talk to your friends about. If you've been to camp or other friends with diabetes, talk to them we're more than happy to put you in touch with somebody too, but to really find a way that you feel comfortable talking about it. It's a very scary thing to think about, but the biggest thing is to just be comfortable with what you're talking about and to use humor. You'll be surprised that a lot of the people you do talk to are actually more interested in hearing more and very interested in what you experience and want to be able to help you in any way that they can. So to just really feel comfortable with whatever you decide to talk about. The second is dorm life. It is very different. So to just have everything around you so that if something goes wrong, you can deal with it, but to not get too stressed. Everything will be at your fingertips in some way, and especially if you put the thought in beforehand. It's not something to be too stressed about once you're set. The next is the dining hall eating. The dining halls can be halfway across campus. They can be right next door. You can have different meal plans. Just figure out what works for you. If, for instance, I had an all-you-can-eat meal plan, it was horrible. I needed to make that smaller and get some supplemental food for the crazy hours that I was working. So find what you need to do for yourself to stay healthy, and just talk to your school and have them help you. The registering with disability services and academic accommodations, of course, within that first week is probably the best time to really just talk to them. Sometimes it's called auxiliary services, and just get started with that, and we can help you as well. And of course, any questions you can just post on our website. Campus Health Center, that first week again is the best time to just touch base with them, just see if they have somebody that knows about diabetes. Mine happened to have somebody that had had it for 30 years. So you'll be surprised in what sort of support you can find. And then the key to college, the social life and having fun. So you're going to have a social life. You're going to want to have fun. To just find a way to do it safely and the way that allows you to keep doing it. I know as soon as my experience is, as soon as I started to try to ignore my diabetes is when it really crept up behind me and kept me from doing the things that I wanted to do. So to be proactive with that so you don't get into that situation. And then just to go right into parents, I know when I first sat down to work on the CDN website and put some parent resources up, I sat down with my mom and asked her what her experience was like and how she dealt with it and what she found helpful. And the biggest thing that she said was how hard it was for her not to nag me all the time because she wanted to make sure that I was safe. And she just said it was just hard for her to just stay busy, find things that she liked or people that she could talk to, whether it be a diabetes support group or just exercising or just anything that she could do for herself to keep from calling me. And then just talking about normal life and not having it all be about diabetes. So it took a little while, but we definitely found the sweet spot with that. And I was able to feel that she was a big support system in my life, and our relationship changed because of that. So to just find ways that you can help yourself, and that is another thing that we're here for at CDN, is to provide some tips on that or even use your experiences to help other parents. So again, some resources on CDN's site. I'll just have Jo give any of her insights.
Yeah, I just had two quick things. So we do know a few parents that we have to go to for questions since we aren't parents ourselves of kids with diabetes. So if you have any questions, we can refer them to those parents who have already gone through it. And the other thing is that we recently put up just a number of questions that students can bring to their dining services, and they can set up an appointment with the director there to really go through what would make their eating experience easier. So whether it be having a scale, having a certain cereal, having a measuring cup, but making sure that even getting the carb counts for certain foods that you want. So really making sure that you're advocating for yourself and you're making it, again, easier for other students who want to know about that information. So I'm not sure.
Okay, let's see. Pam, do you know if there's any other questions that have been added?
Yeah, I've actually forwarded a couple to you all, but if you've not received them, I'm happy to read them. And on my time, go ahead.
Are there two?
Yes, there are.
All right. So the first question is, what kind of support does a CDN school chapter provide? If your school does not have a CDN network and you're not in a position to start a chapter, does CDN have a way to connect with other students with diabetes at their university? And what responsibilities would a student running a school chapter have? Those are some great questions. And I will let you take that one.
Sounds like a question for me. So I guess to start, we speak to students a lot about whether they want to create that network on campus or whether they just want to access resources. For instance, the questions to bring to the dining services or how to connect with their health center. So we really have information for both parties. So if there is not a CDN network on campus, definitely talk to me if you're interested in creating one. And some students really start off small, so they just want to have dinner with people with diabetes once a month in the dining hall to really get to know each other, exchange phone numbers, and just have that network. And that's perfectly wonderful. And other chapters will decide to hold fundraisers and advocacy and awareness events. They'll have meetings every week. They might be reviewing certain resources and research going on in the diabetes field. And they might have product demo nights where they can see the latest technology and connect with reps in their areas to learn about insulin pumps and continuous glucose monitors, meters. And the last thing was, do we have a way to connect students with other students with diabetes at their university? So we do have a database of all of our contacts. So we do have a number of students who haven't yet decided to create a chapter, but they are in our network. So right now we know where they are at school, and they're very happy to talk to other students at that school. So we will definitely put them in touch.
This is Christina. I'll just add to that. So we actually don't have a way for you to contact them directly. Because of privacy, we would have you contact us, just let us know what schools you're thinking, or maybe even if you're just interested in connecting with athletes at college universities, you can let us know that, and then we can help put you in touch with other people that are willing to chat with you or might be in the same area. So we just help to facilitate those communications.
And
the next question is, dining services managers are great resources for special dietary needs, carb info, and food allergies.
Absolutely.
Yes, we second that. Many schools actually have a nutritionist on site that the ones that we've talked to wish that more students with diabetes would come and talk to them. So they're always a resource, and most are very willing to talk to you, whether it be to help you find more information or to just give you insights into the foods that your school has available. So we definitely advocate doing that as well. And I think we are at the end of our webinar. So
actually, I'm sorry to interrupt. We do, on my time check, one of the clocks I was looking at is fast, so we actually do have 10 more minutes. And I have a question that I've received. Actually, it's a comment, and then I'd like to make a comment after it. This comment is from Dr. Henry Rodriguez, and it says, recommendation, students and their families should initiate the process of transition of responsibility from parents to students early on. Many believe that the beginning of high school is a good time. They should work with their pediatric diabetes team to ensure that the student acquires necessary competencies over time so that they can feel confident in managing their diabetes by the time they are heading off to college. It's a process and shouldn't be left until the last visit or two prior to the student heading off to college. So first of all, Henry, or Dr. Rodriguez, thank you very much for that comment, and that is a very good point. And the input I wanted to give into that is that MyCareConnect Blueloop is a great tool for helping to facilitate the student becoming more and more independent and learning self-management. Because of the fact that the student can put information into Blueloop, the parent can simply oversee what's happening with the student and intervene if necessary. But otherwise, the student is given that freedom to manage themselves, and by putting that information in, the parent still knows what's happening, because of course we as parents need to know what's happening, but we would only intervene if we saw something that would warrant an intervention. And we have had just a couple more questions. The first, I'll go ahead and read, and then if Joe and Christina could answer it. Is there a database with colleges and the specific services that they offer within their disability services and academic accommodations?
That is a wonderful question. It is on our to-do list as an organization because it should exist. Right now, as far as a list of colleges, we do offer a list through the CDN website of the schools that we have contacts or chapters on the campus. But in terms of actual disability services information and all of that, there isn't a central database with that information. So you would have to comb through each school's individual websites. However, many of our chapters, we do provide web pages specific to each one on the CDN website, and on each of those isn't that sort of information relative to the disability services, the health center, dining services, local hospitals, local pharmacies, any sort of information that the students on that campus have found helpful or pertinent will be posted on that web page. So definitely check out what we have available, and then if you happen to be on a campus and would like to post that information about that campus, we can do that as well.
Great. And I forwarded another question to you, Joe and Christina, and that is, it's one of our CDEs that's asking the question, Certified Diabetes Educator, and she's asking, what can your pediatric CDEs do to help with your transition? And if I can, as a mom, I'll answer this. First of all, I think Dr. Rodriguez's comments partially addressed this, and I do think that more pediatric endocrinologist offices are becoming aware of the importance of this transition and the fact that so many kids were just kind of left to their own devices, and parents were concerned about how to handle it. So I would say to you, Karen, and for all clinics, to put a process in place, or if you don't have a process, at least start to talk to parents and to students as early as 14 or 15 years old about that process is needing to be undergone, and that self-management does need to start to happen. Joe or Christina, do you have anything to add to that?
I mean, I think that definitely covers it. I mean, the importance of having some sort of program in place is huge. If you are interested in putting something like that into place or hearing more about others, it is actually something that we're starting to compile information on. We'd love to help to connect you with some programs that have already done it successfully or are working through that process now. I know one thing that I would mention is many either local groups or clinics are helping to host off to college nights or transition nights to provide information or even panels in person to talk about questions that we talked about here tonight, or just generally bring up issues that might come up. And that is something else that we can also help you to put on as well.
Great, and I have two more comments and then a question, and we do have about 5 minutes, so if anyone else has questions, please feel free to submit those. And actually, as we are going through these last couple questions, I'm going to switch to our slide that does provide our contact information, so that if you do want to connect with any of us personally after the webinar, we encourage you to do so. The two comments I have, one is from someone at UCSF Peds Clinic. She's saying that they start the process at 14, and age 14, and that they have a dedicated transition coordination to work with families and the UCSF team to facilitate the process. So that's great, again, that more clinics are becoming aware of the importance of that transition and are putting processes and programs into place. And then we also have a comment from Kathy Riggins. She says, as a school nurse, for those who are not familiar with CDN, I strongly encourage you to check out their website and resources that they have, as they are fantastic. So I think that's Kathy addressing those parents and students out there who have not ever gone to the CDN website, that would be a great resource to use. And then we do have one more question that's for Joe and Christina. If we are visiting schools, can we meet with CDN students?
If you are visiting schools, absolutely. Let us know. And if we have a student contact on campus and they're available to meet, we can definitely put you in touch with them, and you guys can find something that works for both of you.
Yeah. This is Joe. So far we've really just been doing it through email, but I'm sure just from the feedback from the students who are already on campus, they say, absolutely, we can't wait to talk to students looking at my school. So definitely let us know.
Okay, and I do have one last question asking if the slides are going to be shared. So just as a reminder, we are recording this webinar, and we will make that recording available. At the latest, it should be available on our websites early next week, and we will send an email with that link to everyone who is participating in the webinar tonight. Are there any other questions before we wind up? Okay, well, I'm not seeing any, so again, feel free to use this contact information to contact any of us if you have any further questions. And otherwise, we'll go ahead and end the webinar, and I appreciate all of you attending and asking great questions. Thank you.
Thank you.
Thank you so much.